Climate change is a long-term change in the Earth's temperature and weather patterns. It doesn't happen overnight. It takes years. It is mainly caused by human activities, especially the release of greenhouse gases from burning fossil fuels, cutting down forests, and producing waste.
So before we continue, let's make one thing clear. Climate change is the average weather in a place over a long period of time, usually 30 years or more. Weather is what we feel every day, like if it's sunny, raining, windy. Climate change means the long-term trend shifting and if it affects everyone.
Because of these human activities, the Earth is heating up. This leads to stronger typhoons, longer heat waves, heavy flooding, and changes in disease patterns. These changes create big risks, especially for countries like the Philippines.
First, climate change increases heat-related illnesses. When temperatures rise, people can experience heat exhaustion, dehydration, heat stroke, and worsening of existing conditions. Workers, children, and the elderly are most affected.
Climate change worsens respiratory problems. Hotter weather and air pollution make asthma and allergies more severe. Smoke from wildfires and emissions mix with warm air, making the air harder to breathe.
Third, we also see an increase in vector-borne diseases like dengue. When it gets warmer and rains more often, mosquitoes reproduce faster. This means more dengue cases, especially during the rainy season.
And lastly, extreme weather events like typhoons and floods can cause mental health issues. People experience stress, anxiety, trauma, and grief after disasters. The effects are long-term, especially for children and low-income communities.
Climate change also affects the storage and distribution of medicines. Many drugs need to be kept at certain temperatures. During heat waves, power outages, or floods, maintaining proper storage becomes difficult. This can lead to reduced effectiveness of medicines.
Bottle refills for you in the pharmacy. Unfortunately, I had to return them to stock since you weren't able to pick them up.
We can teach communities about heat safety, proper hydration, mosquito control, and how to prepare
hand sanitizer.
emergency kits.
During disasters like typhoons and floods, pharmacies help emergency responses. This includes dispensing medicines, checking supplies, supporting mobile clinics, and helping distribute relief goods.
Pharmacists also support public health surveillance. We help monitor outbreaks such as dengue, leptospirosis, and respiratory illnesses, especially after extreme weather conditions.
And finally, pharmacies must have disaster preparedness plans, including backup power, secured supply chains, and an emergency stock of essential medicines.
Climate change is already visible. We experience stronger typhoons like Yolanda and Odette, severe flooding in Visayas and Mindanao, and drought during El Nino and record-breaking heat waves.
Communities living near rivers, coasts, and low-lying areas are the most affected.
Many loses homes, jobs, and access to clean water after disasters. Diseases like dengue, leptospirosis, diarrhea, and respiratory infections become more common.
Because we are an archipelago, delivering medicines become harder during storms. Pharmacies in rural areas often struggle with supply shortages after disasters.
For my vacation, we can reduce greenhouse gas emissions by saving energy, recycling properly, reducing waste, and supporting eco-friendly products. Pharmacies can also reduce plastic use and manage medical waste responsibly.
For adaptation, we need a strong disaster preparedness. So this includes early warning systems, emergency kits, safe evacuation centers, and health services ready for outbreaks.
As students and future pharmacists, we can help by joining environmental programs, promoting health awareness campaigns, supporting community cleanups, and educating people on disease prevention.
We must remember, climate change is a health issue, and everyone, especially future healthcare professionals, has a role to play.
Climate change is real. It affects our health, it affects our communities, and it affects our future.
Together, we can make a difference, starting today.